Cancer is nothing but uncontrolled, unregulated division of cells anywhere in your body. There are more than 200 types of cancer, except your hair and your nail. It can affect any part of the body. So the cells divide without any control. That's what they have the ability to penetrate and infiltrate into other parts of the body once they grow in proportion to the site, and they spread to the other parts like bone, liver or lung. So cancer is basically an unregulated, uncontrolled division of cells anywhere in the body. Basically, cancer is nothing but a change or a mutation in the DNA. The signal is altered. So the instructions in the cell which are there in the genes is altered because of the mutation, or the change in the sequence of the atoms is called mutation. So this mutation in the genes leads to cancer. So any cancer is actually genetic in that sense because it is because of the change in the genes. So a gene mutation can instruct a healthy cell to allow a rapid growth of the cell. It can it creates many new cells without any control. So it instead of asking the cell to stop dividing, it asks the cell to keep on dividing. The tumor suppressor genes are not functioning normally. That's why the cells are increasing in proliferation or the division. So the gene mutations lead to division of the cells out of control, out of regulation. So that's how a lump is formed, or a swelling is formed, and it keeps on increasing in size. So what causes the genetic mutation or the gene mutation which leads to cancer? So there are many things which are in our control. For example, our lifestyle. Okay, so the genes, sometimes you may inherit a gene which is hereditary, which is about 10%, right? So by birth you have inherited a gene, that's what leads to cancer in you, that is hereditary cancer. But the risk of hereditary cancer is less than 10%. Whereas the sporadic cancer, the genetic mutation occurs because of various causes. This is what we call as the causes of cancer. Simple, your lifestyle with respect to the habits, what you smoke, what you chew, the tobacco chewing, smoking, right, and exposure to radiation, exposure to some kind of a viral infections, for example human papilloma virus for cervical cancer, or for example the infection in your stomach as well. So the exposure to some infections, exposure to some chemicals like arsenic, benzene, right, they're called carcinogens and they can lead to cancer. Or for example obesity itself is a risk factor for cancer. Similarly, chronic inflammation or a chronic irritation or lack of physical activity are also known to be the causes for cancer. So it could be your lifestyle, it could be environmental exposure, it could be also with respect to some of the infections with the viruses or the chemicals that can lead to cancer. The risk factor for cancer is basically, number one is your age. As the age increases, your risk of cancer increases. Usually cancer is seen in people above 65 years of age. So it doesn't mean that younger age people are not affected, especially in the Indian continent. We have more younger people as well affected with cancer. No age is exempt from cancer. Secondly, your habits, as I mentioned before. So your lifestyle determines what you will become. The smoking, drinking more alcohol, and more sunburn, more exposure to radiation, more obesity, lack of physical activity, unsafe sex can also lead to cancer. Your family history of cancer is also important, and if a small proportion only, as I mentioned before, but again your health conditions, if you have ulcerative colitis, if you have a chronic inflammatory conditions in your body, your risk of cancer can increase. Your environment also plays a role for you to have cancer. So what you drink, what you eat, it also makes a difference. And the chemicals, as I mentioned before, the asbestos, might be the benzene, and some exposure to such chemicals can also lead to. And what is important is there's something called second-hand smoke. If you're not a smoker but you give company to someone who smokes, 25% of lung cancers are because of second-hand smoke. So your environment is important. So your age is important, and your habits is important, your lifestyle is important, your health condition is important, and your environment is important for you to reduce the risk of cancer. So cancer treatment types depends upon the type of the cancer. So there are more than 200 types of cancer, and the treatment depends on the site or the organ that is affected and also the stage of the disease. So the site and the stage are more important for us to look at what type of cancer treatment is to be given. So most commonly there will be surgical treatment, wherein you remove that organ or a part which is affected with cancer. The other part is with chemotherapy. The second part is chemotherapy, wherein you treat cancer and kill them with the drugs which are given into the body through intravenous or oral. The third one is radiotherapy. So radiotherapy is basically you are killing the cancer cells with the help of high dose radiation. So that will shrink and kill the cancer cells. So which treatment, which type depends upon the organ involved and also the stage of the disease. So for some diseases you may require only one treatment like surgery. For some stages of the same disease you might require a combination of treatment like surgical, medical and radiation oncology. Sometimes all the three, sometimes only two or sometimes only one, depending upon the type of the tumor and the stage of the tumor. Just to give a small example, breast cancer in a very early stage, many times you can do away with only one modality of treatment.